So we used a scenario where the team was dispatched to an outlying hospital to pick up a baby who was full term, who was having some respiratory distress after birth, and that outlying hospital wasn't able to meet the medical needs of the patient. So we brought the team in and simulated that nursery, simulated the situation where we would stabilize the baby. We needed to do an intubation to support the respiratory status, and then place the baby in the transporter, and then, brought him out to the truck to bring him to South Shore Hospital.
Okay, so my SAT is there.
They're not used to taking care of our babies. They can be stable.
It's people, we try to do things at real time, so we enforce them to say, really do whatever you're going to do. Take out the needles, take out the stuff that you need to do, and practice with the equipment and utilize the equipment. And I think it gives the people a little more comfortable, like with the IO drill, with intubating the mannequin and doing that stuff. They learn where the equipment is in the bags, and they also learn how to, in the scary situation, they're used to finding it and doing the skill that they need to do.
So part of what we're assessing is not only the medical management or the nursing management of the patient, but also how the team members work together. So there are nursing, respiratory therapy, generally a provider, so that would be a nurse practitioner or a physician, and paramedics. So we're trying to practice those team behaviors, communication, and working together to take care of the patient. The scenarios help people when they're doing this simulation to actually act through what they would do. It's an opportunity for people to practice their skills, practice communication without harming a patient, because there's not a real patient involved. So we were able to identify areas that we might improve. The contents of our bags, so equipment, even procedures, and just the process of loading the patient into the back of the ambulance. It's a complicated process, so it's really great for us to practice those things, and then we can find out what things need to be corrected or improved.